This year at ASCO, we reported a post-hoc subgroup analysis of the JAVELIN Bladder 100 study. So just to remind ourselves, the JAVELIN Bladder 100 study looked at the use of maintenance Avelumab versus best supportive care in patients who had a partial response, complete response, or stable disease with frontline platinum-based chemotherapy. And this study reported that median overall survival in the group who got the maintenance Avelumab was 21.4 months versus 14.3 months in the group who received best supportive care. The hazard ratio there was 0.69. So the trial demonstrated benefits of starting Avelumab in the maintenance setting. So based on the results of the trial, Avelumab has received widespread approval in this maintenance setting, which is really a unique setting because it hadn't been looked at to a large extent in a large trial like this before. So in the trial, patients received the Avelumab plus best supportive care or best supportive care alone after a treatment-free interval of 4 to 10 weeks after completion of first-line chemotherapy. And the treatment-free interval, so the time from the end of chemotherapy to the beginning of treatment on the maintenance study, was 4 to 10 weeks. So that's what patients were allowed to have. So around the same time that this study was being reported, we saw 2 other studies being reported. So one was KEYNOTE-361, and the other was INVIGOR-130. And the results of these studies, which were combination studies of chemotherapy plus immunotherapy, were perhaps not as encouraging as we would have liked. And so one of the questions was whether there might have been a slightly detrimental effect of giving chemotherapy and immunotherapy right on top of each other, as was done in those 2 trials. And so I was really interested to see if there was any difference in this maintenance study, whether the treatment-free interval was shorter or was longer. So really from the time of the end of chemotherapy to the beginning of the immunotherapy or best supportive care. And what we found, and this is good news, is that all groups, so whether they started closer to the 4 weeks or closer to the 10 weeks, all groups derived an overall survival benefit from the Avelumab maintenance. So that's really good news. It's great news for the patient. Perhaps one can say that there was maybe a little trend towards the overall survival being better if a patient started after the 6-week period, so the 6 to 8 weeks or 8 to 10 week period. So again, very, very subtle findings perhaps, but what it does allow us to say is that for patients who are completing their chemotherapy, that they can wait a little bit of time before starting on the Avelumab. And many people, if they've had 6 cycles of chemotherapy, really do want a break. So I think the data support the fact that the patients can take a few weeks off before they start on the Avelumab maintenance therapy. So that was really the findings of this subset analysis that we did.